We have quite a few folks on the line. I know that there are individuals that are still creeping into the webinar, but we'll go ahead and get started for the sake of time. Um, for those of you that I haven't met, my name is Carrie Mayer, and on behalf of Impact Austin, I'd like to welcome you all to our first session of Discovery Days 2022, Real People, Real Experiences. I'd like to extend a special thank you to our Discovery Day sponsors, including our title sponsor, Baird, and our premium sponsors, C2C Media and FVF Law. I've been with Impact Austin for over 2 years now, which is hard to believe, but upon moving to Austin 2.5 years ago, I was looking for nonprofit community and specifically working with women-focused initiatives. And I had quickly heard about Impact Austin and have been blown away by the long-standing impact that this organization has had in the community, as well as the prowess and curiosity of the women that are engaged. I've served on the Social Innovation Grant Review Committee, and I'm currently on the Diversity, Equity, Inclusion, and Belonging Committee, and I serve as the chair of the Learning Subcommittee, which is the committee that puts on and helps facilitate the learning events of our organization, Discovery Days being one of those. Our committee is working diligently to enhance and improve our organization's commitment to education, membership, and grants with a DEIB focus. We wanted to let y'all know to stay tuned and mark your calendars for the next two Discovery Day sessions. Those will be held on February 4th and the 18th over the lunch hour, same time. And so if you can mark your calendars for those. We'll also be hosting breakout sessions after each of these sessions, including today's. So stay on the webinar if you have the opportunity. We'll continue the discussion and network and answer any questions that y'all have. For those of you who aren't aware, Impact Austin is a local collective women's philanthropy group open to anyone female identifying who want to pool their resources to make a bigger impact in our community. Our mission is to cultivate and expand the knowledge, passion, and generosity of our members to make a positive impact by developing strong relationships and leveraging the power of collective giving. Our vision is to unlock the potential in our community by uniting to fulfill our philanthropic purpose. To date, one member at a time, we've donated over $7.87 million to Central Texas nonprofits. And this includes 103 high-impact grants benefiting 83 nonprofits and their clients. We cannot do this work without our members, both past and current. And as you all know, those needs are greater than ever. So we hope that you will join us, and you can check us out on our website. If cost is a barrier, know that please reach out to us. We'll find a way to make it happen. Every grant cycle, Impact Austin members work together in grant review committees to narrow the applicants to 2 finalists in each focus area. The top vote getter will receive the primary grant, 80% of the total dollars collected for that focus area. And then the other finalists will receive the secondary grant, 20% of the dollars collected. The grant amounts are now announced at the start of each grant application period. So that's a little bit about us. And again, we can talk more about that after this panel. We have just a few reminders before we get started. You can use the Q&A function for any submission of questions. We'll keep the answers to the end of the session. And to react, comment, or pick up resource links that we'll be including, those you can find in the chat box. So chat box for comments, Q&A for questions. We're also recording today's session, so you'll be able to reference it after. It'll be posted on our webpage. Now, for today's discussion topic. Central Texas demographics are changing rapidly. These shifts are more than just numbers. Real lives and communities are affected every day. We will hear the human stories that relate to the critical and urgent needs in our community, including how issues represented in the data interconnect to affect education, in particular the teachers, staff, students, and faculty in Dell Valle ISD, how community growth, COVID, and industry infiltration have affected housing needs and affordability, how demographic changes have impacted the health of Central Texans and their access to medical care. And finally, how Impact Austin members and donors can support the work of creating a more equitable community. We will start with an overview of current demographics, including socioeconomics, race, and age for Bastrop, Hayes, Travis, and Williamson counties. And that will happen with Dr. Lloyd Potter. He's the State of Texas demographer and director of the Institute for Demographic and Socioeconomic Research at the University of Texas, San Antonio. Dr. Potter was appointed state demographer on June 4th, 2010. He holds a PhD in demography and sociology from the University of Texas at Austin, a Master of Public Health degree from Emory, a Master of Science in Education from the University of Houston at Clear Lake, and a Bachelor of Science from Texas A&M University. He's a professor in the Department of Demography at the University of Texas, San Antonio, where he serves as the director. Excuse me. I lost the introductions. I'm so sorry. I'm having technical.
That's okay. Let's make you.
I'm having technical difficulties introducing you. I'm so sorry.
That's okay.
1 second. Let me get back to the bio. Hold on 1 sec. My computer froze.
Well, you could just turn it over to me and I'll get going.
Oh, yeah. Well, actually, I got you. I think I got you now. All right.
Okay.
I think the last piece, obviously we have a well-rounded biography from Dr. Potter, but he has extensive experience working as an applied demographer in several settings. And his current research focuses on public policy and health-related demographic topics and training applied demographers. Councilmember Vanessa Fuentes, will moderate today's panel and discuss the real-life implications of shifting demographics in Central Texas. Councilmember Fuentes, Austin City Council District 2, was elected to the Austin City Council on November 3rd, 2020. She is the second Latina to serve in this role and brings more than 10 years of community, public, private, and nonprofit sector experience. As the daughter of a Mexican immigrant mother and military veteran father, the councilwoman's parents instilled in her that education is the greatest equalizer. She's a first-generation college graduate, having attended the University of Texas at Austin. Prior to office, she worked as an advocacy strategist for the American Heart Association, championing causes such as improved access to health, food, and quality and affordable health care. She serves as the vice chair of the Public Health Committee and vice chair of the Austin Water Oversight Committee. She sits on the Regional Affordability Committee and Community Action Network Board of Directors. She also serves on the Austin-Travis County Hate Crimes Task Force as an appointee by the mayor. Councilmember Fuentes will be joined by Dr. Annette Telly. Annette is the superintendent of Dell Valle ISD. As an educator with 30 years of experience, she previously served as the Deputy Superintendent of Dell Valle ISD and formerly as the Assistant Superintendent of Curriculum in Comal ISD and Pflugerville ISD, respectively. She also worked with Manor ISD and Round Rock ISD. Her passion is to encourage each student's confidence and belief system so that they know that any goal is possible. Adriana Kohler is the Policy Director, Texans Care for Children. As policy director, she collaborates with the rest of the organization's policy team to support their efforts, coordinates the team's work across multiple policy areas, and leads organization-wide efforts to shape policy. She also leads the organization's work on maternal health policy. She's frequently invited to testify at the Texas legislature and speak at conferences about maternal health policy, advocacy strategy, children's health, and other subjects. She plays a leading role in a number of coalitions, including Texas Women's Health Coalition, the Children Health Coverage Coalition, and Cover Texas Now. Christina Rosales is a board member of Austin Tenants Council and a Housing and Land Justice Director at Power Switch Action. 2021 community partner Austin Tenants Council ensures housing stability by rectifying Fair Housing Act violations and empowering tenants to exercise their rights through mediation, advocacy, and education. At Power Switch Action, Christina Rosales works with affiliates to build and grow housing and land justice campaigns and strategies that advance housing as a human right and promote public land for public good. Christina was Deputy Director of Texas Housers, a statewide housing justice advocacy group that supports community leaders to become effective housing advocates and holds public officials accountable to invest in community-centered housing solutions. So we have a powerhouse group of panelists, as you can tell. So with that, we'd like to go ahead and hear about their experiences. So I'll turn it over to Dr. Potter.
Okay, thank you. It's good to be with you all today. I think I'm probably sharing the wrong screen, it looks like. I have this down. Okay. All right, so first of all, thank you for inviting me. I'm just very impressed with Impact Austin and all of the work that you all are doing, and certainly honored to have the opportunity to interact with you all. I'm not used to speaking 8 to 10 minutes, so I'm going to go really fast. So here we go. First of all, let me talk a little bit about the population change that we've seen this decade. This last decade, we grew to where Texas population for the 2020 census was over 29 million. We added almost 4 million Texans over the decade. We grew at a rate of almost 16%. That's faster than all but 2 states, Idaho and Utah. And we added more people than any other state. When we look at the population distribution in the state, you can see we have what we refer to as the demographic triangle or the population triangle with Dallas, Fort Worth, San Antonio, Austin, and Houston at the points. And if we were to draw a line along I-35 and count all the population along I-35, the counties that intersected, and east of it, that's 87% of the population. So that really highlights a dichotomy in terms of population density and population dynamics, with only 13% of the population west of I-35. When we look at population change over the decade, and this further highlights the dichotomy in terms of dynamics, all of these green counties, 143 of them lost population. And so while Texas added more people than any other state, we have a large area of our state that lost population. And that means those areas that were adding population were adding a lot. And so if you look at all of the brown and certainly the darker brown counties here, mainly in the population triangle, but the lower Rio Grande Valley and a few counties out west, we do have significant growth in the urbanized areas. And certainly if you look at Central Texas, that's where most, some of the most dynamic population growth is occurring. When we zoom in and look at places, so these are cities and population change over the decade, you can see all of the cities, the incorporated places in Central Texas, added population. If you go out, start going out a little bit out west, you can see some cities that lost a little bit of population. But certainly Austin added tremendous number of people, but all of the other cities within the Austin, Central Texas area added a significant population over the decade. When we look at population change of about 4 million over the decade, it's an important factor to realize that 95.3% of our population change can be attributed to additional people of color in the state. And only 4.7% of our growth can be attributed to people that identified as non-Hispanic white. And so that's a very significant issue in terms of our population dynamics. That has resulted in population shifts in terms of the percent distribution by race and ethnicity, where by 2020, the Latino population was almost at parity with the non-Hispanic white population, and we're at 2022 now. So our projections certainly suggest that the Latino population has exceeded the non-Hispanic white population by now. When we look at the dynamics of population change or the components of change, that's net migration, which is in migration minus out migration. And here we've broken that into international and domestic. And then natural increase, which is births minus deaths. You can see that about half of our population change this last decade, a little less than half, was from more births than deaths. Texas is a relatively young state, meaning that we have relatively fewer deaths, and we have a lot more people in the reproductive ages. So we have a lot of babies being born. But over this last decade, we also saw a shift with dramatic increases or significant increases in domestic migration. So that's a significant factor for us. When we look at county change and the components of change, here are the most significant growing counties in Texas. And you can see Travis added, it was the 9th most significant growing county in the country. Most of its growth, or approaching half of its growth, was from domestic migration, almost 40% from natural increase, and only a little less than 20% from international migration. Williamson County, on the other hand, just north of Travis, almost 3/4 of the population were from, that growth was from domestic migration. So we see dramatic, in places that are growing fast, usually we see dramatic increases in domestic migration. Here are the fastest growing counties in the state. And so you can see Hayes was the fastest growing in the state, and almost approaching 80% of the population change there was from domestic migration. So that's new people being added there. It's not the new households being added. So housing in these counties that are growing very rapidly from domestic migration is a huge challenge, as it is within Travis County as well. And then if you go down here to Bastrop County, you can again see domestic migration driving much of its growth. So it's just showing you the distribution around the state of increase by natural increase. You know, the population triangle here in the Austin area, very significant natural increase growth. But we've seen declines in fertility, dramatic declines with the recession. And in particular with the Latino fertility, we've seen significant declines. That's going to be having some impact because the population pyramid of the state now has a big indentation at the younger ages that will then age up. Those cohorts will age up through our school systems, primary, secondary, post-secondary, and ultimately the labor force. And that this kind of highlights this in this population pyramid here. Here's looking at domestic migration, and you look dramatic domestic migration here on the I-35 corridor from San Antonio all the way up to Williamson County. Just very significant growth. International migration, very significant in Travis County and Williamson County. When we look at where domestic migrants are coming from to Texas, California has over the last decade been the biggest net sender, with Illinois and New York, pretty far behind, but still behind it, and then Florida. So you look at those states that are sending net migrants, they tend to be states that have a high cost of living relative to Texas. And some of them are also in, I don't know if I would say economic decline, but not as significant economic growth as Texas. We are losing some people to Colorado, Oklahoma, Washington, Oregon, and North Dakota. Those are probably largely people that are working in the oil industry. When we look at educational attainment in the state, you can see there's a big divide between the Latino population and the non-Hispanic white population, with 70% of the non-Hispanic white population having some post-secondary exposure or more, and only 40% of the Latino population. And I'll emphasize how much our population growth, about 50% of our population growth over the decade, was from growth of the Latino population. And so if we don't address this issue more dramatically than we have, we're going to run into some challenges. When we look at change in educational attainment between 2007 and 2019 for bachelor's degrees and higher by race ethnicity, you can see significant increases for all the groups. I was a little bit concerned when I didn't see the Latino population increase quite as much, but when you look at the percent increase, it's pretty dramatic. So that's a good news story, but we have to double down on increasing and improving educational attainment among Latinos in Texas. Now I'm going to zoom in on the area and just go through a bunch of slides really quickly. This is just showing you housing stock by the time period it was built in. So the earlier time period is mainly in the urban core of Travis County. You go to 70 to 89, you see it beginning to concentric circle forming here. 90 to 2009, another concentric circle, and then finally another. So you see this kind of pattern of ever increasing development occurring away from the urban cores of the Central Texas area. Here's looking at the distribution of the Asian population, mainly in northern Travis County and south central Williamson County. African American, mainly on the east part of Travis County, Latino population, southeast, and then going into Bastrop and Hayes County as well. And then non-Hispanic white, largely the rural areas outside and the west side of Austin or Travis County. And I'm showing you these because now I'm going to show you information about social and economic characteristics. And many of you are, I'm sure, are aware that social and economic characteristics are aligned very closely with race and ethnicity. So you should be able to see similar patterns as what I was just showing you there. So this is the percent population with a bachelor's degree or higher. Again, those areas that were largely non-Hispanic white have a high percentage with bachelor's degrees or higher. This is those that are working in lower skilled, lower paid type jobs, natural resources, construction, maintenance, largely Latino area and African-American areas with high concentrations of occupations there. When we look at higher skilled, higher paid management business, again, where the bachelor's degrees are, where the non-Hispanic white population is. When we look at foreign born, you can see a little bit kind of where the Asian population is, and then the Latino population, a high percentage foreign born. Let's speak English less than very well, largely the Latino part of the Central Texas area. And then living below poverty, largely African-American and then also Latino areas of the region. And then median household income higher in those areas with high skilled, high paid jobs, bachelor's degree, non-Hispanic white. Public transit, largely concentrated in the center, even though you do have some people commuting in from northwest of Austin. So I've zipped through that pretty quickly. Projected population change, we're seeing in terms of numeric change, we're looking at Williamson County is just growing very dramatically. Eventually, we think we'll catch up with Travis County. Bexar County also growing significantly. In terms of percent change, again, you see Williamson County growing very quickly, as well as Hayes County. So that's kind of the speed of change. When we look at our projected population, you can see where this orange line is the projection scenario that we have that fits pretty closely with where the census is. The Texas will have potentially more than 47 million by 2050. And now we're just a little over 29 million. When we look at change by race and ethnicity, you can see we have where the Latino population is surpassing the non-Hispanic white population right about now, or maybe a little bit in the past, and will continue to dominate the racial and ethnic categories of the state going forward. Non-Hispanic white population kind of leveling off. Asian population increasing very quickly in the state, potentially at parity with an African-American by 2050. When we look at the counties in the Central Texas area, you see Travis County's growth is kind of linear, whereas Williamson's is a bit exponential or geometric, kind of increasing ever a little bit more each year. Same thing with Hayes County, and Bastrop County being relatively flat in terms of our projections. I'm just going to steer you to our website. We have a lot of tools on there. You're welcome to get on there and explore those. And that's all I've got. It wasn't even keeping track of my time, but hopefully I got through that in my allotted time period. Thank you.
Thanks so much, Dr. Potter. We'll now turn it over to Councilmember Fuentes. And just for everybody's heads up, we're going to take the rest of this time for the council. And if we have any questions, we'll turn those over in the discussion or follow up on those separately after the webinar. But we want to make sure we have enough time to hear from the panelists. Just a heads up.
Well, thank you so much, Carrie, for that introduction, and Dr. Potter for your presentation. As you can see, there are lots of good updates there for us Texans to know about and to think about when we think about the future of Texas, and especially for someone like me who represents Southeast Austin. it is very interesting to see the high rates of population changes even amongst our Eastern Crescent, and looking at and knowing that the majority of our population growth in Texas is along that I-35. So as someone who represents a community that's along I-35, the information you shared is very important. And I'm excited for today's conversation as we delve a little deeper into what does that mean for the future of our state? What does that mean for our community? One of the things I did want to highlight is we saw that Austin metro area is growing twice as fast as Texas. And when I speak with my community and people from my district, oftentimes the concerns I'm hearing is a sentiment of being left behind as the city continues to grow and evolve. And that's important because many of our families have generational ties and generational roots here in Southeast. And so it's very important to me as a policymaker to ensure that our hardworking families are not being displaced, and that as Austin continues to grow into this prosperous city that it is, that we don't leave folks behind. And so that means we got to focus in on the types of housing, a mix of housing that we have in the city, all throughout the city, so that we're able to provide more affordable housing options. And we also take a close look at property taxes and the rises within that. This is something I did want to hone in a little bit because the district that I represent, District 2, is also one of the most Latino areas of the county and of the city. And we saw that as our census numbers grew and that the majority of new Texans are people of color, in my district, the proportion of Latinos decreased. It actually decreased by 5%. And so displacement is a rising issue. I often say that we're in a displacement crisis, and as Austin becomes more unaffordable, what we're doing is we're pushing out our working class Austinites further and further out to the edges. And so we're seeing the growth in Williamson County and Hayes and Bastrop, and that's being driven because of our housing crisis, and as well as a variety of factors. And one of the things that I worked on as a policy leader back last summer, it was creating a pilot displacement community navigator program. These are individuals who will be able to go into our communities who are at risk of displacement and let them know about resources that are available to them. If they're property owners, if they're homeowners, we want them to know that City Council just doubled the homestead exemption to a full 20%. We want to let them know how to apply for that. And if they're renters, we want to make sure that they know the type of resources that they have access to, that the city provides, as well as other nonprofits and organizations throughout the city. And so I just focused in on housing, but of course, there's so much more for us to talk about on what that means with a growing state and a growing community when it comes to education, when it comes to infrastructure, and when it comes to healthcare. And we're seeing these disparities magnify amid the pandemic. And so it's even clearer what's at stake and what we need to focus in on. And especially, as you mentioned, Dr. Potter, the fact that education attainment levels, especially in the Latino community, is not really where it should be. So I think we need to do more on that. Which is why I am thrilled for today's panel. We have some incredible experts lending their time today to talk about these issues in greater detail so that we can have a deeper conversation. So first, on the education note, we'll start with Dr. Telly, who is the superintendent of Dell Valle ISD, a school district near and dear to my heart, and a district that I've organized closely with and supported of. Dr. Telly, can you please tell us your thoughts on how you see the interconnectedness of these issues playing out with teachers, staff, students, families that you serve in Dell Valle ISD? What does this mean? What do the demographic changes mean for education?
Thank you. Well, I'm living it right now. Our whole entire district is really experiencing a lot from the demographic changes. And I'd like to share my screen to show you as a piggyback to the last presentation, what exactly this means for us in Dell Valle. So let me pull up my screen. And if you look at a recent demographic report that we received from our district demographer, you can see that the housing market and the future housing in Dell Valley is really exponential. And right here, you can see we're highlighted in orange, and there's 33,971 future homes, and that's significant, obviously. And as we're trying to prepare, that really is something that we have to consider as a school district. We're outpaced right now only by Hayes, but we know with Tesla being in our neighborhood that we're going to grow even more exponentially. And I think what that means for us is we have to think about how the demographic changes are affecting our families, our students, and the size of the district and what kind of decisions we have to make because of that. So for example, if you look at our district, this is annual closings by elementary zone. And in red, you can see that these are the real hotspots where there are more than 300 closings, annual closings in Easton Park, which is down by Collins. You can see it over in the bottom left. You can see that there's 467 annual closing with future lots of 6,375. And then up in the Whisper Valley region at Gilbert Elementary School, while there's 85 annual closings now, there's a future of 6,500 lots. So because of the ever-changing demographics in our area, we're really having to think about schools. We're having to think about overcrowdedness. We're having to think about how we can support our families, what we're going to do for families who can no longer afford their homes. There are families where the cost of housing right now is increasing every day, and lots that used to be 35,000 square acre are now 150 to 200,000. So we're really having to think short-term and long-term about how to support our families and how to support our schools. Again, these are just some areas down in the southern area of our district where McKinney Crossing, Creedmoor, Easton Park, and Collins, we just have over in the Collins area, right now, 7,998 total single family lots with a future of 6,375. Easton Park right now has 10,000 residential with approximately 9,991. We're building between 400 and 500 homes per year. And we have the northern area to contend with by Tesla, and then we have the southern region, which is in this region right now. Addison has 532 total lots with 94 vacant developed lots. 57 homes are under construction. We're building 80 to 100 homes per year. Sunchase, which is in our area, right in the center of our district, Del Valley Elementary School and Popham Elementary School. They're building between 80 and 100 homes per year. There's 599 total lots, 145 future lots. We're looking at growth all over the district. And while a lot of this is driven by Tesla, it's also driven by a lot of incoming businesses that are also planning to come to Del Valley. And we had anticipated growth in the district, but not at this rate and not to this degree. Whisper Valley, again, that's over in the Tesla region. There are 6,996 total lots with 6,500 future lots. So I'm just quickly going through the slides of what we're trying to keep up with. And we have some highlights and how that really impacts our schools, because you're looking at it from a property standpoint, but as superintendent, I have to look at how that's going to affect our schools. So if you look at the orange column, that shows right now the number of students that we have at each campus. And I'd like to draw your attention down to the high school, where right now we have 3,434 students. And by next year, we're projecting about 3,700 school students. And mind you, this is for a campus that was built for 2,800 students. Now in 2023, 2024, we're going up to 3,800. And then by the time we get to 26, 27, we're cresting, we're cresting towards 4,000. So during this time period between now and then, we have to make some big decisions after we just went out for a bond in 2019. How do we prepare for this high school that's going to be bursting at the seams, and it's already bursting at the seams? How do we determine where to purchase land, because we don't have land in the district right now to sustain the capacity of this growth? Where do we focus on? Because as you can see, there's the area by Tesla, there's the area south in the Collins Elementary School region, and we even project that there's going to be growth in the center of our district. And then if you look at Hornsby, Gilbert, and Daly Middle School, that's all in that Tesla region. So it's not just the high school that we have to make decisions about. We have to think long-term about land for the middle school and the elementary schools. And then again, that Newton Collins, as of next year, we're already going to be exploding there. And what that means for us is that while we're trying to determine where to buy land, there's very little land available. And the land that is available, as I said earlier, has gone from about $35,000 an acre up to $150,000 to $200,000 an acre. So when we're looking at making thoughtful decisions about land, we have to be very purposeful, because we need to make sure that we're buying land in the right areas. We need to plan for the future, for future students who are going to be in our district 10 years from now. When you build a high school, it takes about 60 months to build a high school. When you build a middle school, it takes about 30 months. And to build an elementary school, it takes about 24 months, not taking into consideration the time it takes to prepare for and pass a bond. So the way that it really impacts the district is you need to provide for your students and families, and you need to provide safe facilities for your students and families. And we have to make sure that while the growth is happening, we're taking care of the students now. And we're also thoughtfully planning, because we have to take into consideration the cost of land, the availability of land, how long it takes to build schools, how long it takes to make sure that we're transitioning our students from one building to another. So there are a lot of considerations. And when you're asking, how does it affect our district? It affects our district because when we're making decisions about future buildings and classroom sizes and how we're going to support students, especially in times of COVID, when we're trying to social distance and make sure that our students have what they need at every campus, it becomes very challenging. And we didn't expect the Tesla effect to have this type of impact on our district so quickly. We thought that we would have more time to plan more thoroughly, but it's happening now. So we're very fortunate to have a progressive school board who wants to move quickly with us and wants to support the school district. So that means that right now we're in the process of going out for another bond. But the way that the changing demographics also impacts us is the cost of construction. So what used to cost about $160 million to build a high school is now projected to cost $225 million. So we have to think about being fiscally responsible as a school district. We have to figure out how to make sure that when we're bonding, we're being very purposeful as to how we place our dollars towards our buildings. And we have to be very careful that we are pacing ourselves so that inflation doesn't outpace us. So it truly has been a challenge as a school district. In the meantime, we still have a food desert, and we also have a childcare desert. So we don't have the opportunity for our students to, I'm going to stop sharing. We don't have the opportunity for our students to necessarily have healthy food choices. And oftentimes the fresh fruits and vegetables that they get are from gas stations. They don't have the corner grocery stores like you do in downtown Austin, and they don't have the big grocery stores like you do in subdivisions. So with this growth, how do we sustain this food desert? And then childcare needs. We have working families, and with the growth and the businesses, we want our families to be working, but we also want to support them with childcare needs. So as a district, and with Ms. Fuente's support, the city and the county provided childcare through pre-K programs in our school district. The state pays for eligible students, and eligible students are students who are economically disadvantaged. They have a second language as their first language. They're not native English speakers. They are from foster families. They have parents in the military, or they're homeless or migrants. Other than that, students don't qualify for pre-kindergarten.
Yeah, it's such a crazy, expanding access to pre-K is a top issue for policymakers at all levels. And I want to thank you, Dr. Tully, for sharing with us today the lens in which you as a superintendent look at the changing demographics and just like all of the considerations on ensuring that we have building capacity to meet the needs of our students, and that our students are getting state-of-the-art facilities that are conducive to the age that we live in today, but also balancing balancing the needs of where we're at today, but looking at where we're at tomorrow from multiple lenses, including construction costs, land costs, and all of the things. So I just want to thank you, Dr. Tully, for joining us today and sharing with us a little bit more about how the changing demographics impacts education. Next, we're going to move to housing and look at how these changing demographics and our population growth, what does that mean for housing? And today we have Christina. Christina, Austin has been nationally recognized as one of the fastest growing and least affordable cities in the country. I think we're also one of the most segregated cities in the country. I'm sure that your work has been drastically impacted by COVID and the housing crisis that we find ourselves in. Can you share what you've been seeing and how you've been addressing housing needs with the influx of our community growth at the Austin Tenants Council?
Yeah, totally. So as you heard, I'm going to get on my soapbox for just a little bit, and then I will talk about some of the things that I've learned. But as you've heard and seen, witnessed in your communities, everyone wants to move to Austin. And that growth is very important for sustaining our city. And it's very important for who we become. But in my opinion, and definitely from a lot of Councilwoman Fuentes constituents, the priority that we should be concerned about when we're problem solving is the people who currently live here. Who are these jobs going to go to? Are they going to go to people who live here? Or who is this housing going to go to? Is it going to go to people who live here? We should always be asking that question. Many of those folks who the Austin Tenants Council sees and who are super concerned, most of them are people of color. Most of them are working people. They're poor people who are rooted here, second, third, fourth generation Austinites. Some of them have been housing unstable for a long time. They've been experiencing this instability long before the pandemic. One of the core things that we see is that people are being charged too much for housing. I'm saying that very carefully. I'm not saying that people are paying too much for housing, because it makes it sound like it's their fault, and it's not. Wages haven't kept up with the cost of housing in the city, and there are a lot of corporate landlords who are charging too much money because they can, because demand is so high. It's through the roof in Austin. They can charge those prices. And why shouldn't they? They want to make their money. And then the developers who are creating housing want to get as much bang for their buck. So of course they're making luxury apartments. And this concept of trickle down affordability, it's not real, at least not in the short term. And so I want to pause and just say that it's not just growth and the region's popularity that's making things difficult for tenants and generally working in poor people. There are serious political and economic conditions that we have to contend with. I just read a book called Capital City, Gentrification and the Real Estate State by Samuel Stein. It's a really, really great book and gets into a lot of this from a very simple, in very simple language. But one of the main facts to take away is that the real estate industry is now worth $217 trillion. That is 36 times the value of all the gold in the world. Let that sink in. Real estate, most of it housing, is transforming our cities and our urban life. That's why you see all these cranes everywhere. You see all this crazy building. It is because real estate is this like global force that is taking over. And because of all of these, the confluence of all of these things, the city's popularity, the city's dealings with real estate, all of this means that as a city government and as Austinites, we have to house people. We have to deal with this, and everybody is throwing out solutions that are, silver bullets, tiny houses, and inclusive zoning and rent control. All of that's true. Yeah, we have to talk about all sorts of solutions that are at our fingertips. But really, what we have to think about is how our city works. Our city government works with real estate. We have to be careful about that, because if our city is continuing to work with the real estate industry that already holds all of this wealth, there's an imbalance in power in housing, and especially for tenants. In capital cities, Samuel Stein's real thesis is that the emergence of the real estate state, so that is like city governments mostly working with real estate corporations, has brought with it vicious gentrification, displacement of working class people, and has remade our cities into temples of luxury development, rendering global cities increasingly inaccessible to all but an elite few. So that's like the trajectory that we're contending with. And so if you think about the Austin Tenants Council, like who we see regularly, these folks are like powerless in the face of all of these forces. And we have to contend with that. It's like really uncomfortable because a lot of wealth and power is concentrated in real estate in our city. But we have to think about that. So one solution, or one mitigating solution, I think, is building tenant power and leveling the playing field. That's organizing with your neighbors, right? That's ideally what we want to see at the Austin Tenants Council, is that tenants can hold a little bit more power, a lot more knowledge, and a lot more support from elected officials when they're dealing with policies. The Austin Tenants Council has long served tenants in this like tenant-landlord relationship, has long supported tenants to negotiate with landlords on problems, but that's not enough. The Austin Tenants Council has seen during COVID, we've seen rental assistance and issues with landlords wielding power, trying to get tenants out so that they can then move higher paying tenants in. So that's what's happening, but there's also a lot of hope. There's also a lot to say about what we have seen as progress. There's cynicism about the real estate industry's power. There's cynicism about landlords, concentration of power and influence on policymaking, and people are talking about that. So our laws in Texas don't allow for extensive action like tenant protections, inclusive housing, or rent control. That's hard, but I think that building tenant power, supporting tenants, both at the micro level with the services that the Austin Tenants Council offers, and also through the impact grant that the Tenants Council received, which allows tenants to sort of like build relationships, build connections, and to support each other. That's so important. And through that, we could change sort of the dynamic of the power imbalance.
I
I
could
know
not agree more. I mean,
Yeah.
thank you so much, Christina. You have given us a lot to think about, and thank you for providing that book recommendation. Certainly, one of my New Year's resolutions this year is to read more for work and for leisure. So I'm definitely going to put your book recommendation of Capital City on my list. And I just want to give a shout out to the incredible work that Austin Tenants Council is doing in building that tenant power. Austin is a majority renter city, and so it is very important that we are prioritizing the interests of the people, not special interests. So thank you again, Christina, for joining us. We only have about 10 minutes left, so I want to move to our next panelists. We have with us Adriana today with Texans Cares for Children. Adriana, we know that this pandemic has been a challenging time, and especially for our littlest Austinites. And the work that you're doing at Texans Care for Children helps family access healthcare in times of great need, and has a really strong policy arm. And so I wanted to see if you could talk us through the intersection that you're seeing as it relates to these demographic changes and how it's impacting the health of Central Texans.
Great, thank you, Councilwoman. It is such an honor to be here with you all today. My name is Adriana. I'm with Texans Care for Children. We work statewide. We are based in Austin. We don't provide direct services. We are policy-based, so I look at things at the system level, and we work to advance policy changes at the legislature and sometimes in Congress. I lead maternal and child health work, so I could talk all day about the health systems and what is needed to improve access to care. But in thinking about this conversation, I thought it might be useful to focus in on one issue or one demographic to look at how there are many elements that we may need to change as the demographics of the city in Central Texas change. So I often think about, what does it mean to say access to healthcare? We often talk about that very broadly, and I think about it in a few ways. One is first health coverage, health insurance. And I'm going to share my screen real quick. There we go. Okay. Can you see the screen? Yeah. Okay. I first think about health coverage, health insurance that's affordable, that covers what people need, the benefits they need, mental health and medical benefits. Then I think about awareness of programs and benefits available, from Affordable Care Act marketplace coverage to Medicaid and CHIP, which is generally available for children and pregnant women. Then we have to think about the network of providers. As there are more people moving to Texas, that also means an increased demand for doctors, nurses, mental health therapists, and those providers need to participate in insurance networks so that they're available to folks. And finally, the care offered needs to be quality and also provided in a way that makes sense to the community, that is in the right time and right place. We've seen some advances during COVID that telehealth has really taken off, and that has shown that we have some creative strategies to give people medical care at in a more convenient way. Okay, so that's a lot, and there's no silver bullet to some of these challenges. So I wanted to take you through thinking about maternal health, pregnancy health, and birth outcomes in our Central Texas area. 1 out of every kids in the U.S. lives in Texas. We've got a whole lot of births here. It's about 400,000 a year, and that number is just going to grow, despite birth rate decreasing overall nationwide. We have a lot of births here. So we know that for healthy moms and healthy babies, one of the first critical steps is comprehensive coverage before, during, and after pregnancy. Having that coverage improves maternal health, It lowers infant mortality and has a whole range of benefits for a mom and baby. Leads to better birth weight, better preconception care, like taking folic acid and prenatal vitamins, and better use of preventative care. Unfortunately, though, Texas's high rate of high uninsured rate limits access to care. I do not have the numbers for Central Texas. That's not available at this time. But statewide, it's 1 in 4 Texas women of reproductive age are uninsured. That's about 1.4 million uninsured women in Texas. That's the worst in the country, and it's twice the national average. There have been some regional reports done, and it has been about the same for Central Texas, about in that 26%. So I think we're not higher than average, but we're not lower. So I think this is a good number that we could apply to Central Texas too. And this is not good. There are disparities as well. Black and Hispanic women are more likely to be uninsured. And that's because of a variety of reasons. So, what are some opportunities there? I think of opportunities at the state level, but I think as Impact Austin, you also can think about it as philanthropy. We have to protect state funding for Medicaid and CHIP. Medicaid covers half the kids in our state and half the births in our state. It's a very, very important program, and there are some policy issues. There are low provider rates that mean that some clinics may not be able to sustain their Medicaid provider status, or they may look to philanthropy to cover some of the costs when they don't get paid to cover their costs through the Medicaid program. So there are different ways at looking at this. Also, there's some great local organizations around the Central Texas area that do outreach and enrollment and help kids and families sign up for coverage. There's some that help folks sign up for Medicaid and CHIP, and others in this area that help folks sign up for ACA Marketplace during the open enrollment period. One example that comes to mind is Foundation Communities. They help with Marketplace coverage. That really helps improve that coverage status and get more people the insurance that they need. Of course, this is a system issue though. We support Medicaid expansion statewide so that it's not just kids and pregnant women in Medicaid. We are also looking to make sure there are options for lower income lower wage workers like childcare teachers, grocery store clerks. They do not have an insurance option at this moment because our state has not opted into Medicaid expansion. So that's kind of one issue, and I know we're low on time, so I just wanted to show you this real quick. This article came out just the other day in the Texas Tribune. Texas, unfortunately, has been the nation's leader in rural hospital closings. This is not a new issue. This was pre-pandemic. There are about 24 rural hospital closings in the last decade. Now, unfortunately, the first thing to go when a rural hospital is having trouble is they cut services, and they often cut their labor and delivery units. Labor and delivery units are a little bit higher cost. They have specialized services. You'll see the quote here. There needs to be a certain ratio of nurse to patient with specialized nurses that can help in delivery. So we're seeing a growth in maternity deserts. This article in particular talked about how shortages at hospitals, recently during the COVID pandemic and some of these staffing shortages have led to more closures of the labor and delivery unit. We saw some recently, I think about a year or two ago in outside Katy, Texas. And this article talked about one in Big Bend, not in Central Texas, but as more people move out from the Central Austin, urban area into Bastrop, Hayes County, down to Collins and Kamal, they're further and further from a hospital that has a labor and delivery unit. This is what we need to think about over the coming decade. It's a capacity issue as well as an access to care issue.
That is right, Adriana. Thank you so much. And, even here in, thank you for highlighting the rural part of it. I would say even here in Austin, we don't have a full service hospital east of 35. So there are still significant disparities for Austinites today. And so I know that we had jam-packed conversation today, or received a lot of information. And so I just wanted to do a quick lightning round with our panelists. If our panelists can share in one sentence, what is your one request, your highest priority takeaway that you would like Impact Austin members and donors to walk away with today from our conversation on the changing demographics? And we'll start with you, Christina, or with Adriana. We'll start with you.
I think the one thing to think about is in terms of access to care, when we look at the surface, we might be seeing, good patient numbers, good provider numbers, but we have to look at the disparities that we're seeing. Access for Black and Latina women is so much more limited, and we have to support the local organizations that are serving Black and Brown women in particular.
Thank you. Next, we'll move to Christina Rosales.
Yeah, I'm going to pick up that thread Adriana threw down about equity and disparities. When we think about housing solutions, it's very important to think about the most in need first. Think about people experiencing homelessness, people who have long had housing instability. So rather than think about housing as an economic supply and demand problem, thinking about the most vulnerable first and centering policies around them.
Thank you. And Dr. Telly.
I think what I have to say goes in line with what they just said, which is you have to think about the families and equity in terms of making sure that where there's growth, there's food and food opportunities for families, that there's childcare opportunities, that there's healthcare. In Del Valle ISD, we have families who can't afford their taxes in their homes, and they don't have access to some basic needs as well.
All right. And last but not least, Dr. Potter.
Maybe it's least, but last for sure. So, I mean, I think, yeah, what my fellow panelists have said, I think I would echo. I mean, income inequality is a huge issue, and along with that comes residential segregation issue. And if you begin to look at what's behind income inequality, ultimately it's our kind of a history of racism in the country. And then kind of the consequences of that, which are lack of access to educational attainment, lack of access to, good employment. So I think, strategies to address those things, and then that kind of echoes into healthcare, into housing access, into a whole range of other things. So, trying to address those things, again, one at a time, but again, systematically, it's going to be educational attainment and trying to level the playing field there. I think that's going to be a big factor for us.
That is right. So much more is needed to level the playing field. Thank you so much to our panelists today for talking about our changing demographics as it relates to housing, education, and healthcare. Thank you, Impact Austin, for convening today's conversation as part of Discovery Days. Again, I'm Vanessa Fuentes, Austin City Councilwoman representing District 2. Happy to be here today, and happy to continue the good fight in tackling these issues and reducing the disparities that Austinites face. And so with that, I will toss it back to Carrie. Thank you.
Yes. Thank you so much, everyone. I know that we had quick snippets of very complex issues, but we really, really appreciate your time. And I'm seeing lots of comments flowing in about how incredible this panel was today, and ongoing questions. So for those of you that have questions for the panelists, I know we're running over. You can contact, it's contact@impactaustin.org. contact@impactaustin.org, and you can ask any questions there. We'll centralize those, get those to our panelists, and make sure that we address all of your questions. And then I did see, I just wanted to make sure that Dr. Telly saw in the Q&A some feedback from an anonymous attendee regarding Tesla and the opening of a school in the area. So somebody planning to make introductions to you. So we'll hopefully they will be able to reach out to you. There were two quick questions that I think we could answer before turning it over to our discussion rooms or our breakout rooms, which one was from Nora Comstock, and it seems that this would be a question for Austin tenants, for Christina, but it was, what is the cost for the homes, or sorry, for Dr. Telly, what is the cost for the homes, lots, in the areas that were mentioned? I think that was when Dr. Telly was
Yes.
chatting with us.
Yes. So I know in Easton Park, they were beginning in the 200,000s, and very recently they're in the 750,000 range.
Wow. Okay. Barbara Ellis had also mentioned that, you know, I heard it mentioned, and I know we're scratching the surface in an hour-long discussion, but she wanted to hear a little bit more about the growing homeless problem and the intersectionality of that with the areas that we spoke of. You know, this one, Christina, I think would probably, if you can maybe talk a little bit about, that's a big sweeping conversation, but in a nutshell, is there anything that you'd like to share about how you're addressing that?
Yeah, I think a lot of people experiencing homelessness in Austin are people who never thought it would happen to them, from what I have seen. And it's really like housing instability that breeds this issue of growing homelessness. And so thinking about how we address housing stability, how we ensure that like people are able to afford homes is key. And again, it goes back to like, where are your solutions centered? Are they centered around economics, supply and demand? Is it just numbers and widgets and units? Or is it, you know, serving people who need help most? And that's where we have to center our attention.
Thank you. Couldn't agree more. Well, I know we're 8 minutes over. Thank you so much to our panelists today for your commitment to Central Texas and our community. We'll be hosting another Discovery Day session on February 4th at noon. So mark your calendars for that. We invite you to join our breakout rooms. We're going to be putting a link in the chat, and you can just click on that and join to step into those rooms. Again, thank you so much to everyone that participated to learn more. Any questions about Impact Austin, you can go to our website. And just thanks so much for staying curious and informed. We really appreciate you attending. We'll see you soon.